Do you know that there are several women out there that conceive even after taking emergency contraceptive pills? This is something we need to find a solution for. In this very particular video, we are going to talk about emergency contraceptions, the different types, and how you can effectively take them to avoid pregnancy if so.
Ask Dr. Othman on our wall.
We are talking about emergency contraception. Welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any video we upload. And if you'd like to get in touch with me, to have a private chat, a private conversation with me, go to my website www.drothman.com and book an appointment. Let me know your problem. Probably we can find a solution. Now we are talking about emergency contraception. The reason as to why I'm talking about this is because women are coming to my inboxes saying that they have taken emergency pills, but they have still gone on and conceived. They have become pregnant even after taking emergency drugs. This is not good, and that's why we need to talk about this in details. Emergency contraceptions are methods of family planning. They are methods of contraception that are used after the act. After having sexual intercourse is when you are going to use these medicines. Now the issue is some people will use the medicine before the action and then have an action and expect that this medicine is going to work for them. No, these medicines are used after the action. Now, I want to make that very, very clear before doing anything else. Now, when do you take these medicines? These medicines actually can work up to a period of 5 days. Though we shall be looking at the different types. For the pills, they work best up to 3 days. However, for all the emergency contraception methods, it is better to start them early. As soon as the action is done, you should start these medicines. Because the more days that go on, the less effective this medicine becomes. However, in general, the emergency contraceptives can work up to 5 days post the action. Who takes these emergency pills or emergency contraceptives? Because it's not that it should be taken by anyone, whoever wants to just go to the pharmacy, you go to the hospital and ask for emergency contraceptions. This method is supposed to be taken by a person who has accidentally had sex, but they don't have hope, they don't have a plan of giving birth. So you've had a live, unprotected sex, but you do not want to conceive. That's when you should be able to ask for an emergency method of contraception. Then there are also circumstances where there is possible contraceptive failure. By possible contraceptive failure, we mean that someone is on a family planning method or is using any contraception. You know, they have several contraceptive methods, but is suspecting that there is a failure of this method. For example, someone is using a condom and it breaks, or it slips off, or probably you've incorrectly used it, because those devices have instructions on how to use them. Now, if you improperly use them, then you become a candidate for emergency contraceptives. Then, there are also women who are using combined oral contraceptive pills. By combined oral contraceptive pills, or COCs, I mean the birth control pills that contain both progesterone and estrogen. These are the usual birth or the family planning pills people are swallowing. Now, in case you miss for more than 3 times taking those medicines, it means you are a candidate for emergency contraceptive pills. Why am I saying so? You know, these medicines are supposed to be taken on a daily basis. So if you miss for 3 days or more days, it means that the medicine is not going to work. Therefore, you are a candidate. You are supposed to take emergency contraception if you do not want to conceive. Now, there are also women who are on progesterone-only pills. So, for progesterone-only pills, if you are late for more than 3 hours, if you are late for more than 3 hours, because for progesterone only pills, they are supposed to be taken at the same time. For example, if you decide to be taking these pills, these medicines at 3 p.m. or every 2 p.m., it means every day other day you are supposed to take these medicines at that particular time. Now, if you are late for 3 hours before taking this progesterone only pill, the progesterone only pills are those pills that are white. We usually give them to women who are breastfeeding. Now, if you are late for 3 hours and you've had unprotected sexual intercourse, then you should be taking emergence contraceptives. There are also women who are on monthly injections. If you are on a monthly injection and you are late by 2 weeks, you've taken 2 weeks without taking your monthly injection. For example, you are supposed to take your monthly injection like today, but 2 weeks have passed without taking the monthly injection and you've had intercourse, it means that there are chances of you conceiving. Therefore, you are a candidate of emergence contraception. Then there are also women who are on Depo-Provera. I think everyone understands Depo-Provera. This is the injection you are given every 3 months. It's a family planning method. They give you an injection, they inject it here or here every 3 months. If you are late by a month, by 4 weeks, 4 weeks you've not yet taken your next injection, you become a candidate for emergence contraception. There is also failed withdrawal. There are those people who are using the withdrawal method as their family planning, and it is effective for them. Now, there are times when you fail to withdraw properly. If you fail to withdraw properly, then you can use emergence contraception. Then, there are also cases of miscalculation of safe days, because I have taught on several occasions how to calculate your safe days and fertile days. So there are women whose method of family planning is the use of safe days. They have calculated very well from day 1, day this, I'm not supposed to have intercourse. Day this, so if you poorly or you miscalculate those days, then, and you've had sexual intercourse in those days, then it means you are a candidate for emergence contraception. Then there is also the incidents whereby someone is using an IUD or an implant, but there is accidental expulsion. By accidental expulsion of the IUD, it's like maybe someone has had heavy periods, you are having an IUD, but because of the heavy periods, the IUD is pushed out. So if it is pushed out, or if in any case or accidentally the implant you've put on your arm gets out there and you've had intercourse, then it means you should be taking emergence contraceptives. Then there is also suspected failure of any family planning or misuse of any contraception. If you suspect that you've misused or you failed to use that method effectively, then you are a candidate for emergence contraception. So I've talked about all the indications. Now, if you are not falling in that category, in the people we've mentioned up there, then you're not a candidate of emergence contraceptives, and you should not attempt taking them because they may cause effects which are not desired. Now, there are several types of emergence contraceptions or emergence contraceptives, but most of you only know the emergence pills, but there are several types. Now, we have one, the emergence pills or ECPs, emergence contraceptives. These ones contain levonorgestrel, and you are supposed to take 1.5 grams. Listen to this very attentively. You are supposed to take 1.5 grams of levonorgestrel if you are using those emergence contraceptive pills. Now, there are some manufacturers of these drugs that make a tablet of 1.5 grams. If you find that this tablet, whether it's backup or it's POSTINOR, Plan B, whatever you found, if it has 1.5 grams of levonorgestrel, it means you are taking one. And these are, I prefer those tablets. I prefer medicines whereby you are taking only one tablet, which is containing 1.5 grams of levonorgestrel. However, there are those manufacturers that put 0.57 grams, 0.75 grams in each tablet. Therefore, for those ones, you're supposed to take 2, but you take 1, and then after 12 hours, you take another tablet. That is the first type. There is another type of emergency contraceptive called IUD. You know, when we talk about IUDs, people cannot think that IUDs can be used as emergency contraceptives. They can. Actually, for an IUD, it's even the most effective method of emergency contraception. They are the most effective because I've talked about the other levonorgestrel, the ECPs, the emergency contraceptive pills. These ones, their effectiveness stops at 3 days. Okay, some people you can still swallow after 4 or 5, but the efficacy reduces. However, for an IUD, up to 5 days, it can still protect you. It can still protect you. Then we have now, there are circumstances whereby you cannot get an emergency contraceptive pill, or you cannot access an IUD. You cannot have an expert to put a coil or an IUD into your uterus to avoid pregnancy. Now, this is what you're going to do. And again, these procedures are expensive. I am talking to my friends who do not have that money, because emergency contraceptive pills are expensive in most countries in the world. And also the IUD is also very expensive. Now, there are also cheaper methods you can use, but still don't get pregnant. Now, my friends, there are medicines called combined oral contraceptive pills. The usual family planning pills. Everyone understands these pills. The usual family planning pills, those ones, you can still take them. How are you going to take them? You're going to take a higher dose. So you can take like 4 tablets after the act. You can take 4 tablets and then 4 tablets after 12 hours. I am telling you, they will still protect you from getting pregnant. So if you fail to get an IUD, or you fail to get an emergency contraceptive pill, which is expensive, then you can use the usual oral contraceptive pills. They will still help you. Now, what are the side effects? What are the side effects of taking these emergency contraceptive pills? Number one side effect is interference with hormones, with the fertility hormones. So these emergency contraceptive pills, whether you've taken them very well or you've taken them not in the right way, they will still cause these side effects. Some people will receive these side effects. However, some women will take emergency pills and will not get any side effect. But still, the severe side effects come as a result of the misuse. Now, number one are the irregular periods. If someone takes an emergency contraceptive, whether the device or the pills, you may have irregularity in your periods. If you are supposed to have periods maybe in a 2 weeks time or a 1 week time, you may escalate some more days, or like 3 weeks and so on, for you to have periods. And again, in those first 2 months or 3 months, your periods may be irregular and to be. So if you take that emergency pill, or you have any emergency contraception you've taken and your periods become irregular, just know that the cause is that. Give it some time, they will stabilize. Then at times these periods can become heavy, too much blood, they are painful. Then it's still, those are side effects. Again, some people get headache, nausea, vomiting, abdominal pain, and fatigue. However, what you should take, this should be a precaution. If you take, for example, an emergency pill, the emergency contraceptive pill like the other levonorgestrel we talked about, and you vomit before 2 hours have elapsed, then you should take another one. If you vomit before 2 hours, it means the drug has not been effective, has not been taken up by blood. Now, for an IUD, if you've used an IUD as your emergency contraceptive, some people can get that lower abdominal pain. Yeah, some of them can get low abdominal pain. The IUD, by the way, some people it can come out, like we've seen it, there can be expulsion of the IUD, especially if you put an IUD and then you have heavy periods, the IUD can come out. But again, the last side effect we can talk about is escalation of infections. Escalation of infections, especially if an IUD is inserted into a woman who already has an infection. You already have an infection, there are a lot of discharges in your and then someone inserts an IUD, probably. And these cases happen usually due to poor insertions. poor insertion. Someone has not cleaned very well, has not disinfected the uterus, the cervix, and so on, and has just pushed in the IUD. That IUD may push the infections which are outside the uterus or which are just on the cervix, and then you push them into the uterus. That is what we call escalation of infections, PIDs or STIs, if someone has used an IUD. If it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important upload we make. And if you'd like to make a consultation, a private chat with me, go to my website www.druthman.com and book an appointment. We shall be in touch. We shall have a clear discussion of your problem and probably find a solution for you.
Ask Dr. Othman on Masawa Wall.